Welcome to Week Change Program presentation. The disease that we chose to intervene is occupational asthma, and the population that we're going to target are woodworkers. This program aims to identify high-risk employees and provide them with pathways to exit. For the following presentation, we'll describe the system, the intervention, and potential risks and barriers. Occupational asthma refers to asthma caused by exposure to agents present in the workplaces. It is one of the most frequently reported lung disease globally, associated with considerable mobility and economic burden. In Australia, occupational exposure is responsible for about 9% to 15% at onset asthma cases, which is around 1,000 to 3,000 new cases per year. People with occupational asthma often have to change jobs or careers to relieve their symptoms. We spoke with one ex-woodworker who suffered from acute lung problems during her 2 years as a furniture-making apprentice. She said she was lucky to have a second skill set in a completely different industry, which removed much of the financial burden of leaving the woodworking industry. There was, however, a large emotional cost because she had to leave an industry she loved. Risk factors of the disease include genetic predisposition, previous allergic sensitization, cigarette smoking, and most importantly, exposure to workplace agents. Many factors can contribute to the increased risk of getting occupational asthma for woodworkers. By analyzing the causal loop diagram, we have categorized factors influencing woodworkers' lung health into 5 clusters. The driving force within the system is that companies are profit-oriented and their motivation can be found in this reinforcing loop. In the short term, more woodworkers is associated with more wood cut, which will lead to higher profits and lead to more woodworkers. However, in the long term, company profits will be affected. More wood being cut means more exposure to wood dust. Increased exposure to wood dust will affect workers' lung health, which after delay can lower company profits due to decreased efficiency, potential litigation, and claims. In the case of a number of high-risk employees being exposed to wood dust for an extended period, some will want to change their jobs. This is shown in the balance loop beginning at woodworkers cutting more wood, leading to higher dust exposure, which will damage their lung health. After a delay, we can expect that more employees will look for new jobs due to health concern, and this will lower the overall pool of workers available to the industry. Parts of the system have shown their ability to adapt. For example, personal protective equipment have been widely adopted since the OHS Act was introduced in 1991. Our program aims to utilize this track record of adaptation to extend the driving force of the system by taking wood dust exposure and workers' lung health into consideration. Based on evidence that workers who leave the hazardous environment see health improvements over time, our intervention aims to control the source of hazard by increasing woodworkers' job mobility.
The intervention we're proposing will enable us to work with the employees who suffer from asthma and the companies which don't get the desired productivity from sick employees. The majority of wood production industry is located in regional areas which often have few job opportunities, so to find a new job, most must consider leaving the region. Moving with a family can be even more difficult, forcing many woodworkers to choose not to change jobs. Elimination of causal agents is the most effective way to protect woodworkers' lung health. Our program helps workers relocate to other industries or switching roles within the same company. To simulate the intervention outcome, our team used the net logo and found an increase of workers leaving the job will result in a decrease of workers having bad lung health. We start by approaching the company where wood dust is prevalent. We will explain to company managers that allowing at-risk workers to leave their current role will benefit the company's long-term profit. This includes allowing at-risk employees to work on a flexible schedule. Our first step is to identify workers with high-risk asthma based on the HADIS definition and including time off for lung condition. This could either be reported by the company or by workers. Our second step is to work with workers to build a removal from causal agents plan. This includes personal situation analysis and decision-making, including website with the information needed to get a full understanding of their situations. The personalized action plans remove the risk aversion a worker will feel about the process ahead. If the employee is willing and able to stay within the same company, they can start learning a new role by shadowing another person for a few hours a week depending on the workload. When a position relevant to their new skill is available, they can transfer. A third-party training organization can offer further education for the transition. If the employee decides to move to another job in another region, our team will develop a personalized move plan with long-term occupational support and support for their family. Determining a viable secondary skill sets comes from discussions with workers and career experts. A government-funded vocational training provided will ensure these skills are up to professional standard. For those moving to a new region with a family, our staff will provide an introduction to new schools, estate agents, and ongoing personalized community integration support. How will we pay for it? Bring together the already available relocation assistance to take up job grant alongside government databases and funded training providers will cover the cost of nuts and bolts of the program. However, paying for management and staffing is still an issue. We considered three options to find the fundings for the staffing of the program and decided to use the model as outlined by LHA Fabry in Week 4, where those companies who expose employees to wood dust pay a proportion of their profit into the blind trust every year.
Initial program testing would be done by identifying a number of regional woodcutting facilities to work through a trial. This trial would focus not only on identifying and helping individual workers move jobs, but also focus on the efficiency of the program itself. We would then take the learnings from the first trial and retool the program for a second trial. This trial and retooling process can be undertaken a number of times before an optimized program is developed. The first trial would have a strong hands-on process by the team, but over time more trials would see less hands-on and more of a focus on the integration of the digital tools into the program. During the trial phase, questionnaires for those who've been introduced to the program and those families who've used the program will help measure the success of the educational and job change support mechanisms respectively. One issue with removing high-risk workers from the causal agent environment is replacing them. Working with job search organisations, we could identify potential candidates with low risk of poor lung health from wood dust and use already available government funds to train them in the various skills needed in the woodworking industry. A clear focus on education of company managers around the possible long-term profit risk of workplace-related asthma is aimed at addressing a lack of desire amongst woodworking companies joining the program, as is the fact that the intervention isn't coming directly from employees, unions or the government, but an independent and trusted third party. Finally, the strong family and moving support mechanisms worked into the program are aimed at alleviating a worker's family's reluctance to move. Because the program brings already existing government infrastructure funding and training under the one roof, with some extra help for workers, it can be scaled across industries and health issues. Identifying occupational health problems that deliver the largest negative economic impact to the country and tailoring our program to those areas would be the next step in its development. Alternatives could include a public awareness campaign via the Media and Workers Union, which may pressure companies to value safety above profit, as well as increasing the awareness of safety procedures among workers and the wider public. DNA testing could also be introduced to remove those with the genetic disposition to poor lung health from the pool of woodworkers, while an intervention outside of work could also reduce the poor choices affecting lung health, such as smoking and drinking.